So this morning I actually had trouble recording the webinar, so I'm going to be sharing with you a very brief summary of what we had spoken about in today's session. Today we recapped very briefly what we had spoken about yesterday about the importance of record keeping for medical missionaries, in particular for healthcare professionals who do work under a legal body or a registration organization. But in addition to that, I also shared that in my own personal experience, one of the key areas where this can really become a problem is not necessarily with the person that we are helping, like the patient, but in many cases, it's a family member or a neighbor or somebody close to that person who has some questions about the treatment that they had received. Maybe that person is unsure about whether the lifestyle principles that were taught to them are really that important. There could be various different reasons, but family members are often more likely to raise complaints than the patient themselves. And here still, regardless of what our circumstances are, it's important for us to just keep that in the back of our minds and prayerfully ask the Lord to guide us as we move forward into the times that we're heading into. We also spoke about and reminded each other that we are currently not necessarily in situations where record keeping is absolutely essential, but we never know where the Lord is going to send us next. And maybe He's calling us from where we are working at the moment into a different setting, into a different community, into a different country for that matter, where some of these principles may be even more essential. So in today's session, to briefly summarize, we spoke about scenarios where we may need to refer patients to a different person. We emphasized how important it is for us to remember that we are not here to start a revolution. We are not here to sweep people up against the medical system. On the contrary, we fill a specific gap and a role within the larger scheme of healthcare in whatever country we work in. And as we need to fit into that, we also sometimes need to interlink with the healthcare system when we conduct referrals. Sometimes we are going to deal with somebody where we can share health information, we can teach them lifestyle principles, but maybe their situation is of such a nature that it either exceeds our individual level of training. Maybe I don't know all that much about this particular person's condition, or I can see that they are seriously ill and they need further assistance from an organization such as a hospital or a clinic. In those cases, what we spoke about yesterday becomes even more relevant. Good record keeping and providing that person with some kind of referral letter that summarizes what I see when I do their assessment or what my reasons are for referring them can be really valuable. Speaking from the perspective of a receiving doctor, having worked at hospitals where patients are referred to us, it can oftentimes be very difficult when you receive a patient and you have no idea why they were sent to you or what the individual who sent them actually found and what they were concerned about. Patients don't always know all the details about their condition. They don't always understand their diagnosis. So trying to get that information directly from the patient is difficult, but having a short note that summarizes what the individual saw who sent them to you is very, very valuable. So accompanying that person or sending them with some kind of accompanying documentation is incredibly valuable. It also helps to build trusting relationships between the healthcare sector and medical missionaries. When a medical missionary does an assessment and they're able to provide professional referral letters when they send somebody to a hospital or to a doctor, it really helps to build the trust relationships and break down barriers that medical professionals may have against lifestyle workers, health educators, or medical missionaries of any religious kind. So these are just some tips that you can use. In addition to that, we also spoke about how important it is that when I'm going to refer somebody to any other healthcare professional or institution, that I make sure not to send them away without resources. Printed resources or electronic resources could be really valuable, but making sure that they have something to refer back to the helpful information that I want to share with them is useful, because the referral process is often confusing for people. It's a stressful process sometimes if they need to be taken to hospital. Sometimes they spend a number of days or weeks in hospital, and by the time they are discharged, they can't remember what they were taught by the lifestyle educator. So as a medical missionary, if I can provide them with resources to take with them, that can help for them to refresh their memory about what I had shared with them. And I want to equip them with information about the laws of health, even if I'm going to be referring them. The next thing we spoke about is how valuable it is to provide them with contact details so that they can actually get back in touch with us. I sort of think about this as closing the loop. When they leave from the health educator, the health ambassador, or the medical missionary, and they go into the other healthcare system, be it private or state-based, it is valuable for them to know how to get back to us, where they can access more health education, where they can access further free health information, or other assistance with natural remedies or home treatments, which they may be interested in using on the long run. So providing them with contact details is useful. It is also extremely helpful to have some templates and some referral letters or some health information sheets that are set up and pre-printed, if that is a possibility. It is costly and it's a difficult resource sometimes in certain communities and different settings, but if you have some printed resources that you can provide to that person, both with the information and contact details that you want to leave with them, it can really save a lot of time when you're dealing with people. We wanted to emphasize as well in our discussion this morning how important it is for us to keep safety first. It is challenging sometimes when we need to refer patients because we know that the people we refer them to don't necessarily have the same sentiments or share our sentiments about the value of lifestyle changes, but oftentimes the people that we are referring to also don't have the same viewpoints from a religious perspective. And we spoke about how our goal remains not only to help that person with physical health, but to connect them with Jesus, to represent Jesus. So when we refer them to healthcare professionals who are, for instance, not even Christian, that can be challenging, but the person's safety is important. And if we see danger signs, it is not right for us to ignore those danger signs just because we want to keep them within our sphere of influence. We need to find safe ways to interlink with the system, but provide them with opportunities to get back in touch with an organization, be it our ministry or another ministry, who can help to support them on their spiritual journey. I hope that these are helpful hints for you to put into practice, and maybe that will not necessarily be an essential component of the work that you're doing at present, but you never know where the Lord leads us in the future. If you have questions about what we have shared in today's session or any of the other lectures we have shared so far, please make sure that you send them to me either directly if you don't want to share them publicly, or put them in the comment section for the videos. And if you've been blessed by these sessions, if you have learned something new, make sure that you share with others who are also able to access these lectures on the YouTube platform. Make sure that you subscribe, and may the Lord bless you on your learning journey.